Hello and welcome to the Caregiver Teleconnection session. My name is Minerva Villarreal. I'm the Foundation Program Coordinator with the Wellman Charitable Foundation. Today's presentation, we're going to be discussing caregiving for someone with cancer. And our great presenters, Elliot and Lucy Sklar, will be doing this presentation. The session is recorded and it will be posted on our website, www.caregiverteleconnection.org. And if you have any issues, you can always call our customer service at 866-390-6491. Now, let me tell you a little bit about our speakers. Dr. Elliot M Sklar is a public health professional with a vast experience in managing health programs and initiatives. With over a decade of practice in supporting the health of the public through academic work, research, and service to communities across the Americas, Dr. Sklar shares his passion and expertise in support of diverse caregivers and the complex issues that they face. Now, Lucy Barylak is a social gerontology consultant with the West Central Montreal Health in Montreal, Canada. Lucy is a renowned expert in caregiving, having won the Queen's Jubilee Award twice, presented by the Canadian Home Care Association. Another thing about Lucy is she was a caregiver for her mother. And with that, take it away.
Thank you so much, Minerva, and welcome everyone. You know, the fact that I'm wearing pink today is not a coincidence. We've hosted some disease-specific programs this year for a specific group of caregivers. And today we have a unique program that's focused on caregiving for someone with cancer. This month happens to be Breast Cancer Awareness Month, and you might see a lot of pink ribbons around. And that's why, in honor of that, I am wearing a pink shirt today. We've decided that this was a very important topic to include because cancer survivorship is increasing. And that means that there are also more cancer caregivers. There are also other issues too. We've had many caregivers over the past year of individuals with dementia and Alzheimer's who are battling different types of cancers or who are cancer survivors and for whom going to routine follow-up appointments can be especially challenging. As people are living longer and surviving with cancer longer, it would be only natural that there are more comorbid occurrences of diseases, which means that they're co-occurring. So in addition, as I was saying, more and more cancers are being treated now more like chronic conditions. And as a result, the death rate from cancers is very different than it was about 25 years ago. Cancer had long been one of the leading causes of death in the United States, but according to new research published last fall, more people than ever are surviving the disease. Now, the annual report from the American Association for Cancer Research found that the US cancer death rate had actually declined by 32%. That's about a third. That's considerable between 1991 and 2019, a decrease that has saved roughly 3.5 million lives. In fact, the number of children and adults living with a history of cancer exceeded a record 18 million in January of last year. And just as our population has gotten older, 64% of cancer survivors are 65 years or older. And in case you didn't know, Alzheimer's is actually the cause of more deaths than breast cancer and prostate cancer combined. So researchers said that the reason for these changes and advances in cancer survivorship are due in great part to better prevention, detection, diagnosis, and also treatment options. Between August 1st of 21 and July 31st of 2022, the FDA, the Food and Drug Administration, approved 8 new cancer therapeutics and 10 already approved therapeutics for use for new cancer types. In addition, there were 2 new diagnostic imaging agents that were approved. We've also seen a revolution in immune therapies. So when you combine these with also targeted treatments like chemotherapy and radiation, there are treatment options now that we didn't see years ago. And that's also provided that people are getting diagnosed early. We talk a lot about the importance of prevention, and some cancers are even managed now also as chronic conditions with treatment, not intending actually to cure them, but to simply prevent further growth. And you may have seen some of these ads on television for new cancer drugs that talk about increasing your years of life rather than actually curing the cancer itself. And so here we are in October, Breast Cancer Awareness Month. And one of the things that we talk about routinely is that female caregivers are known to get less preventative screenings. That includes cancer screenings like mammograms. So we wanted to take the opportunity to remind our participants and those working with caregivers to make sure that people are on top of preventative screening. We need to talk about it. We need to encourage people to go and get screened. It's one of the key reasons why we have more people living longer as a result of successful treatment outcomes. And many people are able to live with cancer for a longer and fuller time. Now, with that comes caregivers with different challenges, experiences, and this is something that none of those reports on cancer survival actually address, which is really important. So one of the challenges for some patients and caregivers who have cancer is living with uncertainty and even communicating about the disease and follow-up care. And that's really important.
Thank you for that, Elliot. You're really, really right, because communication is key. Even when it comes to discussing and defining the population we're focusing on today. So, who is a cancer survivor and what are their caregiver needs? The phrase cancer survivor can mean different things to different people. It is often used as a general term describing someone who has had a diagnosis of cancer. This means that the cancer survivorship starts at the time of the diagnosis. Even though it might seem strange, the definition includes people who have no signs of cancer after finishing treatments, people receiving extended treatments over a longer period of time to control the cancer or reduce risk of its return, and people with advanced cancer. But this is because the term cancer survivor begins at the time of the diagnosis. This is also important because it highlights that the cancer survivors may have very different caregiver needs at different points in their journey or depending on the circumstances. Not everyone who has or had cancer uses the word survivors. For some people, this term doesn't feel right. They may feel more comfortable defining themselves as a person who has had cancer, a person living with cancer, or another way. The most important thing for a cancer patient or survivor is to be able to explain and discuss your medical and emotional needs with your healthcare team and your loved ones. We have to give people that opportunity. That's why people should find words they are comfortable with to name and navigate their personal challenges, changes that have come from their cancer diagnosis and treatment. Most people have the common belief that their life will be, in quotation, different after cancer. However, these life changes are also different from person to person. Some people find that they have a hard time coping and adjusting after active cancer treatment ends. This transition usually means less frequent contact with their healthcare team. People may feel uneasy or distressed before a medical checkup at certain milestones or more often. It's important to remember that people experience survivorship in many, many different ways. So let's kind of look at some of the common experience among cancer survivors include feeling relief and joy when the cancer treatment is over and wanting to recognize that milestone, having new or challenging psychological support needs such as with self-image, anxiety, or grief over your losses. And that could be for many women if they've had their breasts removed, uncertainty about the future, fear that cancer will come back, experiencing positive personal changes and growth. Some people have said, in a way, this has been like a life-changing experience because they've changed the way they were looking at life, maybe more in a negative way, and seeing it more in a positive way. Having long-term physical side effects from the treatment. Some people have pain, changes in dynamics of relationships with friends and family. It does have an impact because when someone is sick in the family, everyone in the family is sick as well. Because of the journey that is cancer and cancer treatment, sometimes caregivers do not self-identify or recognize the role that they play in supporting someone through that journey. And that, as a caregiver, you're also on that journey. So even though it's a different kind of a journey, you're still part of that. I think that this happens more than we might think because cancer affects all people at all ages, and their unique experience might require unique support and different structures of caregiving than we might associate it with regular ones. You might not have to do daily care, but it might be more of an emotional support. Younger people might want caregiving support from friends and family and kind of maybe push you away a little bit. And their issues may be different than an older person who gets a skin cancer diagnosis, for example. So if you're helping your family member or friend through cancer treatment, you are a caregiver, okay? There are different types of caregivers. Some are family members, while others are friends. People of different races and cultures, even gender and sexual identity, give care to others in their own way. Every situation is different, and there isn't one way that works best. So let's have a look at coping with being a cancer caregiver. Giving care and support during this time can be a challenge. Many caregivers put their own needs and feelings aside to focus on the person with the cancer. This can be hard to maintain for a long time, and it's not good for your health, I can tell you that. The stress that can have both physical and psychological effects. If you don't take care of yourself, you won't be able to take care of others. It's important that you give care to you. Whether you're younger or older, you may find yourself in a new role as a caregiver. You may have been an active part of someone's life before, but perhaps now that they're a cancer patient, the way you support them is different. It may be in a way in which you haven't had much experience, or in a way that feels more intense than before. And that is because the journey of illnesses has twists and turns. As a result, so does caregiving. So I'm glad that you're with us today because educating yourself and accepting the fact that you are a caregiver in a different way can be extremely helpful.
Absolutely. And Lucy, as you were speaking, something that I thought of is very often people who get a cancer diagnosis don't want that to be sort of like a mark on them forever. And sometimes if you're also dealing with individuals experiencing cancer, I like to call it an experience because it means that it's something you can move beyond. And for many people with cancer, that gives them a sense of hope. It's also a neutral kind of language or more hopeful kind of language rather than saying cancer survivorship that I think we should get more in the habit of using. So if you are a professional, as an example, working with patients, think about that, because the disease can be an experience that we move beyond. Absolutely. And as you said also, I think we're more accustomed to talking about caregiving when it comes to older adults, and usually people also with cognitive impairment. So it's a little different when it comes to caregiving for someone with cancer, because when it comes to older adults with cognitive impairment, the main source of that care comes from usually adult children or spouses. But when it comes to caregiving for someone with cancer, that can really look very different, and that can be for many different reasons. For example, when it comes to some cancers that are more intimate, like breast or colon or prostate, some patients might only want to be cared for by a spouse or a partner, whereas other people feel that they don't want an intimate partner. to see them in a certain way. So it can be very different for different people. And as a result, for example, other friends or extended family might serve as a source of support in caring for that person. Many adult children with cancer don't want to rely on their parents for care, just as parents may have a hard time accepting help from their children who are adults. Caregivers may also have health problems themselves, and we know this across the board, making it physically and emotionally difficult to provide care for someone else. More recently, I think because of COVID and all of the changes that have occurred, caregivers across the board are finding it very hard to balance taking care of a loved one along with job responsibilities. So the pandemic created a shift in how we're balancing work and life. Many people are now having to return to offices, which is putting a new kind of strain on what may have become their routine. And alternatively, for people who work remotely, there's a culture of expectation that we're always expected to be available, connected, and online. That makes it actually very hard to take a real sick day or a real mental health day, or to disconnect when you're with someone who might be undergoing treatment. So those are important things to think about, and perhaps some important boundaries that you may need to draw so that you have better balance. There are also some disparities among cancers that link with specific issues for specific communities of caregivers, and I wanted us to talk a bit about this. One of the best things about the caregiver teleconnection is the diversity in our audience and participants. We have people from across North America who represent a variety of different communities, and this is a very important issue. So Black populations have historically been disproportionately impacted by cancer and other health disparities. In fact, in the 1990s, the association had been noted that cancer death rates were about a third higher for those who were Black than those who were white. Now that disparity has declined, but even in 2023, Black populations continued to see disproportionate death rates in the United States. Gastric stomach cancer is also nearly twice as high among those who are American Indian, Alaska Native, Asian, Black, or Hispanic compared to those who are white and non-Hispanic. And Native Hawaiian, and other Pacific Islanders were 38% more likely to have advanced head and neck cancer, and 18% more likely to die compared to those who are non-Hispanic white. So these are just some statistics and examples, but these disparities also extend beyond just race. Gay men are about 4% more likely than heterosexual men to report a lifetime diagnosis of cancer, which is quite interesting. In addition, rural county residents, those who don't live in city areas, are about 34% more likely to die from lung cancer than those in urban areas. We would think that that might be the opposite if you think about pollution. And people with low education and income levels are more likely to be diagnosed with advanced lung cancer as well. Now, why are these disparities existing in the United States? There are a number of factors. That includes access to health insurance, location, for example, people who might be in a rural area where they may have more fresh air, as I said, more likely to die of lung cancer. That may be because they're not getting screened appropriately, or they might not have access to the same prevention. So there are a lot of reasons, including location of where you live, systemic racism, structural inequities, and lack of healthcare workforce diversity. That's a very important one that people don't think about. When healthcare providers are not attuned to these disparities that I'm discussing, as an example, they may not look for these things in their patients because we tend to see things through our own life experience. So it's important to help, make others a little bit more aware of some of the disparities if some of these were surprising to you. I'm just curious what some of you think about some of these statistics before we move ahead, and if any of this resonates with you.
Right, everyone, if you'd like to participate, just go ahead and unmute yourself. you don't feel comfortable talking, just go ahead and type it out in the chat box, and we'll be more than happy to read it out for you.
I've always felt very strongly about these disproportionate numbers because I'm a social worker. So in school, I've learned the entire time that these populations, especially that are listed on this slide and beyond, of course, are impacted by social determinants of health in a much broader way than, of course, white, non-Hispanic, dominant identifying factors in society. So it's hard for me not to think that those social factors like discrimination and, of course, like you mentioned, the environment don't contribute to this stuff. You know, everything that society pushes at an individual can likely, you know, there's no full research to back this, but likely increase these numbers.
For sure, yeah. You make a very good point, for sure. That's for sure. I mean, it's kind of shocking when you see those kind of statistics, and it tells us a lot about our healthcare system in general, and how do people access services? Are there services? You know, I'm thinking about rural areas. It's such a high percentage, but how do you deal with lung cancer? Are there services? Do you need to then go into the city? What if you don't have a car? What if you're financially not able to do so? How do you deal with all that?
Well, one of the things that has become more common are infusion centers where people are getting treatments, for example, immunotherapy and things like this. And that's one of the challenges because there are not enough of these infusion centers, especially in rural areas. So it's very challenging for caregivers who also have to consider being the source of someone's transport and how do you take time off of work. And, you know, it's a very complex thing. And Morgan, you touched upon that when you said social determinants of health. It's right on the money. So I really thank you for that comment. I think the important thing here for us too is that we know from research, but also from experience, that caregivers from minority and diverse backgrounds are less likely to seek out caregiver support. Now, to me, this is a concern because caregivers of people with cancer or who have survived cancer have unique concerns and challenges, including even identifying themselves as caregivers, as we discussed. And they need support that might be more unique to the relationship they have with the person for whom they are caring, or even a different level of flexibility with work to be able to take someone for treatments and doctor appointments. So if you're participating today or listening to a recording, please seek out the resources and support that you might need. You can always reach out to 211 in any community to find out what specific resources exist in your community. There are many local groups that are led by volunteers or nonprofits, so it's really important to know what is around for you. We'll also be providing a number of resources at the end of our presentation, and as always, you'll receive a copy of these slides if you registered for our program today. So if you work with patients, cancer patients, or survivors, make their caregivers aware of support resources whenever you can.
Thank you for that, Elliot. You know, caregivers of people with cancer or cancer survivors have a hard time with coping with uncertainty, okay? Frankly, coping with uncertainty is hard for almost all of us. And unfortunately, that comes with the territory here. Cancer survivorship requires increased doctor appointments and tests to confirm the absence of cancer, and there can be very stressful and challenging to cope with for patients and for caregivers because there are consistent reminders, constantly reminders, and uncertainty of test results every time. So you could just imagine if you have to go through this every few months. You know, research shows, in fact, that when it comes to caregivers of patients and survivors of cancers, dealing with uncertainty is the most difficult of the emotions they experience as caregivers. So we might want to rethink our relationship with certainty. Remember that the saying about the tree that doesn't bend, the tree doesn't bend with the wind in a storm, it'll surely break. Learning to go with all the twists and turns that comes with caregiving and uncertainty is what is needed, and that might take some practice. We might enhance our lives by accepting limbo and how we navigate each day to learn and tolerate ambiguity, hard word to say. And many of us practiced this during the pandemic. So it can be a good way to think back. How did we cope at that time? Or we handled the uncertainty that came with COVID in the initial months during the lockdowns. So for example, we talk a lot about staying in the moment, and sort of just being there and accepting the good that is at that particular time. Understandably, uncertainty might feel frustrating, challenging, and uncomfortable. That's why self-compassion can be so important. Rather than judging yourself for feeling stressed during times of uncertainty, you can acknowledge that it's normal to feel that way. You can also choose to engage in more self-care strategies. Give yourself time to process your emotions and prioritize activities that inject fun and meaning into your life. As I was saying, staying in the moment and doing things that you enjoy. The more you can be self-compassionate towards yourself, the less likely it is that you'll feel ashamed or not good enough for feeling stressed during the uncertainty. Instead, you can offer yourself kind and understanding support, which might help you feel less stressed and can also build your ability to tolerate uncertainty in the future. You might also like to focus your attention on supportive and kind thoughts, such as, I'm safe and well, or I have been through worse, I can handle this. It may feel silly or strange at first, but this is a simple way to show yourself compassion during challenging times. And I have to admit, I use that a lot, and it does help. So whenever you notice yourself fixated on your inability to endure uncertainty, try to challenge that assumption. You might encourage yourself to acknowledge that your thoughts aren't necessarily accurate. It can also be important to believe in your ability to cope with any outcome that may arise when uncertainty ends. It can be helpful to introduce a structure into your life that is certain, like keeping a routine, even if it's a thing that you can do each day. Sometimes uncertainty can be particularly frightening, especially if you don't believe you're capable of dealing with potential negative outcomes. Perhaps you're worried that if the worst does unfold, you won't be able to handle it. There are two strategic ways you can tackle this belief. Okay, let's look at that. One, encourage yourself to be optimistic and choose not to spend excessive amounts of time dwelling on potential negative outcomes. You might encourage more positive thoughts by starting gratitude practices like writing down 10 things you're grateful for each day. Or before you go to sleep, just look at your day and just say, I'm so grateful for what I do have. Reflect on exercise in the past when negative things did happen and you didn't have the ability to cope. Maybe turn to support network and assistance from a mental health professional. Perhaps, look for someone that you can, a self-help group. I guess what I'm trying to say is you don't have to do this alone. You can take the second technique further if you're up to it. Allow yourself to imagine the worst case scenario for the situation that is on your mind and allow yourself to visualize giving up and accepting the situation and the consequences. Imagine the things you'll need to carry on rather than dwelling on feelings of it. Once you have a rational grasp on the positive of dealing with the situation, you can begin to move out of the emotional swamp. By saying, I can handle this. And I guess what this really says to you is that at least you're taking some control by going to the worst case scenario. And I have to sort of share with you, many times that's exactly what I do, and it's extremely helpful to me. So I'm just wondering if anyone else would like to share any other thoughts or coping skills that you've learned, especially during the pandemic.
Folks, if you'd like to participate, just go ahead and unmute yourself. For those of you calling in, just press *6 and that will unmute you. Again, our chat box is open for you to type it out if you don't feel comfortable with talking.
Difficult. This is a really tough thing for a lot of people to cope with because really we're dealing with our own mortality and fears about that, I think. So if you are feeling a little shy, if there are things that you do want to share with us, just as a reminder, Lucy and I will be staying on after the formal presentation today for an unrecorded anonymous discussion and to provide support and answers to any questions that you have. So again, does anyone have, oh, I see something in the chat. Morgan says, I always note time heals everything or mitigates bad situations. This is one moment in time, even if it's long. It's such a great point. And we've had someone actually share something similar, you know, that to think about in a, like in a week, well, how will I feel in a month, in a year, in 10 years, will this matter? It is good to provide that perspective, even in the moment, because it allows you to visualize, you know, that even though this is a crisis right now, hopefully in time, it won't be that way. So that is a very comforting thought, I think, as well. Thank you, Morgan. Something that really helps me feel like I have a grasp on some modicum of control when things feel completely out of control, as they did during the pandemic, is exercise. We know that exercise is a natural and effective stress reliever and anti-anxiety treatment. You can also try adding a mindfulness element and focusing on how your body feels as you move. I find myself sometimes doing this when I'm in a yoga or a Pilates class, more importantly, because there is a focus on the movement and how your smaller muscle groups feel, but paying attention to the sensation of your feet, even just hitting the ground as you walk, or in autumn, as it is now, if you're living in the north, how it feels to walk on leaves that have fallen. It's such a nice thing. So dance as well is another excellent example of sort of getting in touch with the rhythm of your body, your breathing, or being outdoors and feeling the sun or the wind on your skin. We don't suggest running a marathon, quite the opposite. In fact, research has shown that 11 minutes of exercise each day has a positive impact on our health, our well-being, our mental health. There's also a lot of research that shows how beneficial exercise is for cancer survivors. And in fact, exercise actually impacts survivorship in a very positive way. So if your care recipient is up to it, it can be important to partake in exercise together, like taking walks outside. There's one last thing I wanted us to discuss as it bears importance to all of us. A few weeks ago, someone brought up the concept of trauma and trauma-informed care as being increasingly important as we age. And it is something I want to discuss because it links certainly to the experience of cancer survivorship. One thing I wanted to note about the slide that I have here before we move forward is that we have an excellent link that's embedded here at the bottom to Memorial Sloan Kettering Exercise and Cancer Resources. For those of you who don't know, Memorial Sloan Kettering is one of the top cancer treatment centers in the country, and they have amazing resources. They're not the only ones. We have a lot of good stuff to share with you. But I do want us to talk a bit about trauma and trauma-informed care. What does that mean? So trauma-informed care shifts our focus of what's wrong with you to the question of what happened. It allows us to better understand people's life experience, and it's relevant in our discussion today because the experience of cancer can be traumatic, and it can be that way for caregivers as well. And I'll share personally, when my mother was going through breast cancer treatment, She refused to allow me to take her to any of her chemotherapy appointments because she never wanted me to see the patients that were receiving treatment. And it's something that she did to protect and shield me, but it was also frustrating for me as a caregiver because I felt I couldn't do something that I wanted to be supportive in. So this is just one example of those different dynamics that are important to really recognize and appreciate in these exchanges and experiences, because it is unlike caregiving for other circumstances. I think this has also been very true for a lot of caregivers during the experience of the pandemic. This was a very scary time for all caregivers, but certainly for caregivers of people with cancer who may have been undergoing treatment and had a lower immune system, which was a very big concern for patients and for caregivers, and still is, because as we were saying, even ahead of the hour, COVID is still out there. Now, caregivers of cancer survivors often feel a hyper state of vigilance about their own health, and even increased anxiety about their own health concerns. And that can sometimes be because of having witnessed other people's experience, treatment, etc. So, it's very important to just recognize when we are feeling that heightened level of anxiety. That's also why, if you consider, people are told never to Google their own symptoms for something, because, Google usually will say it could be cancer. Unfortunately, more younger people are being diagnosed with cancer too. For example, colorectal cancers, the recommended screening for colonoscopies has been lowered below the age of 50 now because younger people are getting more colorectal cancers. So it's important to be aware of these things. And hopefully your primary care physician is discussing appropriate prevention and treatment for you in terms of what diagnostic tests you might be needing at a certain age or based upon family history. Unfortunately, more younger people, as I was saying, are being diagnosed with cancer. In fact, an estimated 1.2 million adolescent and young adults diagnosed with cancer worldwide each year. But the survival rate is exceptionally high. However, when younger people face cancer diagnosis during important developmental life stages, and that could be during childhood or even early adulthood when trying to build a career or a family, or even starting to save for retirement, these things can be interrupted by cancer, and that can be challenging and emotionally challenging as well. It can be hard for caregivers too, because dynamics in a relationship change, as Lucy was saying earlier. And for some, this can lead to psychosocial and behavioral challenges like post-traumatic stress disorder, psychological distress, and anxiety surrounding fear of recurrence for patients and caregivers alike. So it's, again, we can't reinforce it enough, so important that you get help and support from the professionals that you need. Usually this is available for cancer patients, but not as readily accessible for caregivers. And one of the reasons is caregivers, again, don't self-identify. So support groups, professional help, whatever it might be, it's important to access help if you need it. Also, there are activities to support your social well-being, which might include keeping in touch with people by phone, by Skype, FaceTime. We did this again during the pandemic, recognizing the importance of connection. And it's important as well that your emotional health might benefit from routine. We talk about this often, routine of waking up at a certain time or including one thing that you do every day. It might be journaling for a few minutes or mindful coloring, being creative, or just giving yourself some time to learn about new things or listen to a podcast or an audiobook. When you're feeling overwhelmed by uncertainty, or if your thoughts are spiraling in a negative way, return your attention to things you can control. That's why I like exercise. It allows me to remind myself that if I can make it through 30 minutes on the elliptical, I can get through anything in the day. And taking things one step at a time is very helpful in doing that.
Well, thank you for that, Elliot. Those are excellent points as they relate to younger adults and to people in general. There are also some specific challenges for older adults and caregivers. As you said, Elliot, cancer survival rates are increasing. 64% of cancer survivors are 65 and older. As people are living longer, that sometimes comes with the development of other illnesses. We've heard from many caregivers whose parents have Alzheimer's and are either cancer survivors or have been diagnosed with cancer. The combination of Alzheimer's or dementia and cancer can be challenging for caregivers to manage, and sometimes shifting a focus between disease, which can be hard. So you can just very well imagine if you have to deal with both of those situations. You know, we received a question from a caregiver that I'd like to share with you. My mother is 85 years and has Alzheimer's disease. When she was about 82, she was diagnosed with breast cancer, which she beat. About a year after that, she was diagnosed with Alzheimer's. The combination of events is still hard for me to grapple with as a daughter and as a caregiver. It was hard to see her suffer through treatments only to make it through to another disease. My question is that as her Alzheimer's had progressed, is it more difficult to take, it's more difficult to take her to follow-up appointments with her oncology team and the annual tests and scans that she has to endure. She gets very anxious and agitated when she's out of her home and in a hospital setting. Do you have any tips? Well, yeah, I mean, this is a very extremely challenging situation to be with. I think the first thing that's so important is to speak with the oncology team to address your concerns. You got to kind of let them know what's going on. You know, perhaps a little tranquilizer might be helpful, or even less frequent follow-up visit or test could be something that you could agree upon with the doctor, depending on which illness is more concerning and presenting as symptoms. This is a difficult thing to discuss, and sometimes very important to broach that, to accept the reality. Discussing a need for ongoing follow-up care could also depend on the type of cancer. So this is important conversation that needs to occur. You can also ask the oncology team for help, see if they can work with the Alzheimer memory team to make these visits easier for you as a caregiver. But one of the things that I really would highly recommend and suggest that you might need some individual counseling just for yourself to be able to cope with the situation differently. And going back to the uncertainty and going back to acceptance, that's really, really very hard. But once you accept that that's what's going on, it somehow gives you a bit of a way to kind of try and tackle these situations as they come along. You know, what can I say? There's so many ways of dealing with things with your mother that has cognitive impairment. One last technique that we want to share is called soothing touch. Now, soothing touch is a self-compassion strategy you could try during times of uncertainty. You know, research has found that the release of all these hormones in your body increase the levels of well-being, and less stress can be prompted by low intensive stimulation of the skin, such as gentle touching and warmth. And one way that we can kind of look at it together is place one hand in a location on your body that feels best for you. Feel the warmth of your touch and try gently rubbing your skin in circular motions. Can be practiced with a care recipient. Just touching in general is such a way of getting, if you're dealing with someone who has dementia, to get their attention and to connect with them. You know, so these are just little tips that we have. It's also something that you can practice, as I said, with the person that you're caring with. Touch is so very, very important to us. I was wondering at this time if anybody would like to share some of your tips that you may have in dealing with self-soothing or with self-care.
And everyone can give themselves a little hug, rub your shoulders. It really does work. There's a lot of research to back it up, but I also think that that's why people have pets.
Yes, I think you're right. Pets are a wonderful thing. They really give you a lot of love and warmth, for sure.
Yeah, And pets, just like soothing touch, both release oxytocin in the body. And that hormone makes us feel much more calm. This issue about cancer and Alzheimer's is one that's coming up more and more. People are living longer. People are living as cancer survivors longer. And the issue of follow-up care is a very challenging one. A caregiver that I know who used to work with me and has participated in some of our programs before has a similar situation. Her mom is a lung cancer survivor and then was diagnosed with Alzheimer's disease. And now she lives in a assisted living facility because it has become so challenging to look after her. And as you can imagine, coordinating cancer follow-up care and screenings is very challenging. And her mom was becoming very agitated. So they did speak with the oncology team, and it turned out that her mother's cancer was a very slow-growing cancer, especially at her age, in her late 80s. And so they had made the decision, a difficult one, to forego routine follow-up care for the time being, because her Alzheimer's is progressing so quickly, and that's what they're most concerned about. So it might vary in each situation, and I think it is important that we bear in mind that as people are living older and as cancer survivorship is increasing, there are the likelihood of other diseases co-occurring. And Morgan said, yes, pets, love listening to music and using blankets as the weather permits. Absolutely. Those are great ideas. And thank you for sharing, Morgan. I think it's really important for caregivers, we say this all the time, to practice self-care. Because if you're not caring for yourself, it makes it much more difficult to care for others. And also some of the things that we find comforting are things we can share with the people for whom we are providing care. Unlike with Alzheimer's patients who may have advanced cognitive impairment, cancer patients have very different experiences and are cognitively very different. So it's important to share in those things that are enjoyable together as well. Please go ahead, Lucy.
Yeah, no, I just want to share. I mean, I have a much younger friend who's going through cancer treatments, and I know and who has a young family still at home, that uncertainty every time he has to go back to the doctor. But having the tools to deal with it certainly helps. And he did get a lot of counseling around that. And one of the things that he knows that makes him, when he gets uncertain or anxiety, is to actually spend a day in the country. Nature for him gives him the resources. And I think it, as Morgan said, music. For some people, that's what it is. So each one of you, people have to find that little tip that really helps them get through the uncertainties and the anxieties that are so normal, and recognize them. Always recognize, acknowledge your feelings of what you're going through, and see how can you get through that in a much calmer way.
All excellent points. We have resources to share, as we always do, and these are hyperlinks when you see something that is underlined in our presentations. So we certainly welcome you to check out some of these resources. We will pass it over to Minerva because I know that she has some announcements to make. And then we'll open it back up for discussion. And as Lucy and I were sharing, we will be staying on after the formal presentation for an informal discussion.
Thank you, Elliot. Great presentation, like always. And I just have a few little reminders letting you know what we have upcoming in the month of October. On Monday, October 9th, we have Medicare open enrollment with Felicia Warner. That's going to be at 12 o'clock Central Time. On Tuesday, we're going to have Dr. Berderio with Diagnóstico y Tratamiento de la Demencia. That's going to be at 10 o'clock Central Time. And then on Wednesday, October 11th, we're going to have Lucy and Elliot again for their series for the month, Our Health is Our Wealth. And this time they're going to be covering physical activity. All of these you can find at our website, and you can see listed. If you have any questions, you can always send us an email at caregiversos@wilmot.net, or you can go to our website, caregiverteleconnection.org. I would also like to share this information that's coming up for the month of November. Every year, we've been having a summit, whether virtually or in person. With the COVID, we've decided to keep it as hybrid. So if you would like to register for any of our sessions, on the 9th, it'll be in English, and on the 16th, it's going to be in Spanish. Please go ahead and use the hyperlink that we have, that I put in the chat if you would like to register. If not, you can always give us a call at 866-390-6491, and I'll be more than happy to help you get registered as well. Does anyone have any information, questions that they would like to ask at this time while we're still doing the presentation?
I have a question that has come up with many of the caregivers I work with, whose care recipient has cancer and dementia, comorbid, of course, sometimes along with other things. But if somebody is diagnosed with cancer at a point where it's questionable as to whether they can make their own medical decisions, sometimes they will tell their caregiver, I don't seek this treatment anymore, whereas another day they'll say, I don't want to die, for example. And do you all have any advice, as to how to navigate that if, of course, you yourself are a caregiver?
Well, that's an excellent question and an extremely, extremely difficult one to follow up, especially when somebody has cancer and has any form of dementia. Now, are you in the United States or are you in Canada? I don't know.
I'm in the United States.
You're in the United States. Okay, so let me generally speak, and then maybe Elliot will address it differently. Obviously, I think the important thing is that if there are any issues about the person's ability to make their own decisions, it's very, very important to make sure that that person is properly assessed by a doctor and a social worker. Now, back where I live in Quebec, many people have what we call a mandate, and that when they were alert, they had designated someone in case something happens to be their mandator. It might be different language, and Elliot will, clarify that a little bit more. And maybe it's time to, what we call it, is to homologate that document, meaning that maybe that person is not in a position to make the right decisions for themselves. But taken into consideration, if they have a living will, they might have specified there what their wishes are. And it's really, really important to be able to meet the wishes of the individual person. But it is very, very difficult to make those decisions. And it's hard for caregivers to do that as well. So I think it's a team effort. I think if the person is competent enough to make a decision that it's their life, and if they don't want any treatments, we have to. But on the other hand, if they fluctuate back and forth, that might be a time to really see what can be done. And is the caregiver ready and willing to make those decisions? It's not an easy session, a one-time session. I think it needs a lot of time and effort to sit with the caregiver and to really talk about what promises were made or not made. And a decision at one point needs to be made, but it is hard. Elliot, maybe you want to come in, and maybe the laws are a little bit different in the States than they are back in Canada.
They're a little bit different just in the terminology, but the essence of it is the same. And that's why we try very hard to encourage people to have these discussions earlier in life so that you can create advanced directives and paperwork that you need to honor your wishes as things happen. What you're explaining is a very common challenge that we're seeing right now. In addition, when going for cancer treatment, some older adults are being determined that they have cognitive impairment and that they cannot potentially make decisions about their treatment for themselves, which calls into question a whole bunch of other things: who makes the decisions, who is the assigned caregiver if one has not already been assigned. Because in the practice of medicine, if the intent is to first do no harm, not providing treatment is doing harm. And so it can be a very, very tricky thing to navigate. You brought up something that I think we could have a whole dedicated series about. Try your best in your practice, because you're a young clinician, to get people to think ahead, to plan ahead. In fact, many people who have advanced directives have them in case they become cognitively impaired, but they don't make other provisions in case, for example, they're diagnosed with a secondary illness. So these are things that should be thought about as a worst case ahead of time so that planning can be appropriate and timely.
Yes, because for many people, sometimes religion plays a role in this too, of how decisions are made. There's other family members that even if the primary caregiver, let's say, for example, wants to fulfill the wishes of that person, maybe the adult kids don't want to. So these are all really difficult situations where I believe that counseling, even family counseling, really comes to play a role. And many times you're not going to come to any sort of a final decision. It's one step at a time. But these are difficult issues for sure. Thank you for bringing that up. So I think we're coming to the top of the hour. There still are a few people that are still with us. Should we take a 2-minute break, Elliot? We'll take a 2-minute break.
Hold on, before we go for the break, I want to stop the recording. Elliot, Lucy, would you like to say any final words?
No, we're just happy that people joined us. It's a hard topic. I want to thank you, Minerva. The recording will stop and then you can remain anonymous or not. Thank you, dear.
Thank you.
Let me stop it now.